everyone. Welcome to our sixth episode of this live program of Coping with Infertility. Today we have a very special program. The title of this episode is Coping with Infertility in the Workplace. I am Dr. Mugdha Raut.
I am Dr. Mohan Raut.
We are both gynecologists and clinical reproductive immunologists. We treat couples with reproductive failures, that is, with recurrent miscarriages, IVF failures, and unexplained infertility with the help of lymphocyte immunization therapy or our patented and branded Immunology and other individualized passive immunomodulatory protocols. We have 6 centers all over India in Mumbai, Nagpur, Pune, Delhi, Bangalore, and Hyderabad, where along with my husband, Dr. Mohan Raut, we treat these couples of reproductive failures. Today, in the workplace, we see a lot of women and men, of course. Women are choosing to have, rather I would say couples are choosing to have their first pregnancy a little later on in life. And at that time, many of them suffer from reproductive failures like unexplained infertility, IVF failures, or miscarriages. And many times, what we see is either the woman leaves her job because she feels that because of her workplace, she is not able to conceive. And of course, she still miscarries or still has IVF failures. And the second is that they continue their job. And both the wife and the husband have to face with constant questions and answers from their colleagues at the workplace who may mean well, but each question makes them feel guilty or some inferiority complex. So today, we again welcome for this 6th episode, Dr. Akshata Bhat, a renowned psychiatrist. Welcome, Dr. Akshata Bhat.
Hello, namaskar.
Welcome, Doctor.
Dr. Akshata Bhat is a renowned consultant psychiatrist with her own practice at Vileparle East. She has extensive work experience in both the public and the private sector. After completing her MD in psychiatry from Nasik, she worked for 1 year as a registrar at KEM Hospital, Mumbai. In the past, she has worked with a de-addiction clinic in South Mumbai, managing and treating patients with substance abuse disorders. She has also been associated with various hospitals and clinics in Mahim and Dadar. She has also closely worked with schools in Vileparle to improve the awareness about mental health. She has done parenting workshops as well as stress and anger management sessions for faculty and parents of school students. She's also a consultant psychiatrist at a child guidance center in Vileparle, dealing with academic, behavioral, and emotional problems faced by children and adolescents. She has carried out regular workshops in anger and stress management, work-life balance, study skills, and mental health awareness. She has written numerous articles on mental health disorders and uses social media to promote mental health. She is well versed in handling cases of depression, mood disorders, schizophrenia, dementia, and substance abuse. She is passionate and enthusiastic about her line of work and hopes that mental health will one day definitely be given the attention that it deserves. So who more than Dr. Akshata Bhat to guide us on how to cope with infertility or reproductive failures at the workplace?
So, welcome, Dr. Akshata. I think as Dr. Mugdha said, that the problem of infertility anyway is on the rise. And because of the work pressures, because these couples who are working, because of the work pressures, they tend to postpone their planning of pregnancy, and then they later on face this problem of infertility. So because of infertility, then they have problems at home, in the family, in the society as well as at their workplace. So today we are specifically looking at what are their problems at the workplace. So to begin with, Dr. Akshata, how does the workplace environment impact the individuals going through infertility treatment or in the infertility struggles? How does it affect them mentally?
So, hi. For today's talk, let's first talk a little bit about what both of you just said about how couples are going in for children at a later age than usual. And I think one common reason for that is the financial aspect, because everybody wants to be financially stable before they start a family. And given the rising expenses, plus, what you have to plan for ahead in terms of education, as well as taking care of basic necessities at home and things like that. So it's a very common trend we're seeing that couples are much older now when they're having their first child than what it was, say, 20, 30 years ago. Another common thing is now that both partners are working. So this is also a very common scenario that both of them are working maybe sometimes at the same intensity, at the same level. So this is a very common scenario you must be seeing very frequently. Now, this can cause a lot of stress because as in a workplace, for example, it's a very common thing once you get a little acquainted to start asking personal questions. And it's not uncommon for someone to say that, oh, you've been married for, so many years, but you guys don't have kids yet. Don't you want children? Aren't you planning for them? So these kind of invasive questions are very common. And a lot of people may want to keep their private life private instead of discussing it in a workplace. So they may not be very comfortable. But like I always say, Indian society, there aren't a lot of boundaries left. So people feel that it is absolutely fine to ask these questions even to someone whom they've just met or whom they know very casually. Usually, I feel this is a very personal question. It should not really be asked to anyone. But this is a common scenario that most couples face. So here, I think it can be very stressful because this is something that is already playing on their mind also, that when are we going to be able to plan this, because they're thinking financially, they're thinking socially, they're thinking, are we mentally and emotionally prepared to have a child right now? So I think when people ask such invasive questions, it can make the environment at work more stressful because you feel that apart from work, I also have this to uh, face when I come to work, people asking me personal questions about my life. So, for the people asking the questions, I would say please don't ask such questions. I think it's very personal, it becomes very invasive, and it becomes very uncomfortable for the person at the receiving end. For the people who are unfortunately at the receiving end, I would say that start answering diplomatically, firmly, politely. Get to the point. If you don't want to discuss it, how much you want to share, what you want to discuss is your prerogative. There is no compulsion that just because you are in a social situation or at work, you have to discuss your entire personal life. So it's perfectly fine to say to people, hey, this is something very private or very personal. I'm not comfortable discussing this at this juncture. And maybe we can take this up later, or maybe I would never want to discuss this with you. And it's absolutely fine to do that.
So because of these situations that they face at workplace, exactly how does it impact their mind or their emotionally or mentally? What happens to them, or what does it lead to in these patients? What problems that will cause in these patients?
So already, I think they're used to a lot of people asking them this question. I'm sure friends and family have already been asking them that when are you planning to have your child? So after that, coming to a workplace and having people badger you there that, when are you going to have a kid? Why don't you have a kid? Don't you want kids? Don't you think you're getting a little too old? Do you know that as you get older, it becomes harder and harder to conceive? Unwanted advice. People will be ready to give you all of that. So I think for a lot of people, it gets very stressful. It can get very embarrassing. It can make you angry also, justifiably. So it's a very private issue. Somebody asking such questions, in front of maybe other colleagues, or even just the fact that it's so invasive. It can also make you very sad because then that realization keeps coming up even at work. Maybe when you're at work, you feel like I can forget about these things. But even at work, if people are asking, you're constantly reminded that, yes, this is one aspect of my life which I haven't been fulfilled in. So it becomes very stressful. Also, if you go by a typical corporate culture, or I think most workplaces nowadays are like that, the work hours are very long. The commute is also long. And after that, There are other responsibilities to be dealt with, irrespective of gender. For most women, when they come home, apart from working, they also have to manage the house and do other chores as well. So it's not a very easy situation to be in. And on top of that, if you're constantly being bombarded about, things that are already stressful for you, I think it will be very difficult for anyone, like feeling that kind of stress and anger and sadness.
Even I think some amount of depression also may set in. Maybe there is another person in the office who is pregnant, and will that also impact her, or someone who has delivered? So will that sometimes cause overthinking and even depression? Do you think such feelings
So,
also will come may come in?
So it's very common to compare with somebody of our own age group, right? So if there is somebody of a similar age or maybe even younger who's getting pregnant and or who've just delivered and successfully had children, that tendency is there to think that it's happening for them. Why isn't it happening for me? You may feel, which is a very human thing. You may feel a sense of anger towards that person, or you may feel jealous. Again, all of these are very human emotions. Though we always tell people that think positive and everything, the fact remains that feeling angry, feeling jealous, feeling sad, these are all very, very human emotions. We cannot deny them. Okay. The problem starts with how you respond to these emotions. It's not having the emotion that is bad, it's how you respond to it. So it would be very understandable for someone to feel sad and anxious that, it's not happening for me, it's not happening for my family, but everybody else seems to be settling down and very successfully having, children and, going to the next phase of life. So I would understand that there would be a certain amount of anger or resentment towards someone else, but we have to not act upon it. One thing is feeling angry or feeling resentful, but not acting on it.
So I wanted to ask you one question is that does this have a impact on their work? Means this constant, there is nagging at home, there is questions in the office. Will it affect their work? And second, if yes, they need to learn how to communicate effectively with their colleagues because work has to happen. So how can they communicate effectively with their colleagues on their reproductive failure issues? So is there any you can say any tricks or any tips which you would give? Because if it will affect their work, it will affect their performance. And affecting their performance is going to affect a lot of things in the long run.
So, one thing I want to mention here is how much you want to share about your journey is up to you. It is your prerogative. If you feel that this is something I want to disclose, this is something I want to share, please do that. If you are not comfortable, that's also fine. Everyone's sense of boundaries is different. Just because some people are very comfortable talking about it does not mean that everyone else will be. Some people may be open to taking suggestions. They may even ask you directly that, do you know anybody who's an infertility specialist, and some people may just not want to address it. So I think we have to understand that it's different for different people, and anyway, it's fine. The way you choose to deal with it is absolutely fine. If you want to share, you can. Now, because it's a sensitive subject and because it's a subject that people find it difficult to open up about, what I would suggest is when you talk to somebody, let it be somebody that understands you and respects you and is a little open minded and receptive to different things, because this is not going to be easy for you to unload as well, so getting a good sounding board would be a good thing. But if you get someone who is not giving you a very helpful response, it might backfire. You might end up feeling bad for yourself that, why did I take the trouble to share? So I would say that see if you have some sort of emotional resonance with the other person, or if you feel that they are able to comprehend the problem that I'm going through, then yes, it is worth discussing. Also, in situations where there may be potentially some medical emergencies that may occur, or some reason for you to take frequent leaves of absence from the office, yes, it is worth discussing with your superiors that, this is the treatment you're going through, which is why you require maybe leaves, maybe more privacy than others, or maybe a change in your daily schedule because you have to go for appointments and things like that. It is worth discussing.
Yeah, so I was actually going to come to the next question is that do you think that any workplace should be more flexible considering if when the woman has to take frequent leaves or change their schedules
Hmm.
so that they can fit everything in together so that it becomes easier. I mean, this is a natural thing. This is not something which is brought on by the couple onto themselves. So is it a good thing that if they can be flexible and more accommodative of situations which, and I think mostly the women go through it because they have to take the daily injections, they have to go for sonographies. So do you think this should be put into practice, flexibility?
So I would also compare this with the recent controversy over period leave. Now, that's a very debatable topic because everyone has their own viewpoints. And as they say, as Rachel Green says in Friends, no uterus, no opinion. I think women should have more of a say in this rather than the men, because for those who've undergone menstrual pain, I think they're the only ones who understand how difficult it can be. So similarly here, agreed, the most of the brunt of the treatment is to be faced by the women, like the injections and the hormonal treatments, as well as the frequent sonographies and the checkups and everything. I think if it, I mean, it would be great if there was a little bit of leeway given for that, because it is a natural thing, it is a part of the process. And if all these things are required, then why not? There should be some amount of allowance made for the same. Also, at the same time, this should not be used against people that, oh, because like how, the controversy about period leave is that's the same, that women will be perceived as weaker and cannot do the same amount of work as anyone else and things like that. That's not the argument. What we're trying to point out here is there are people who get pregnant in a healthy way. There are people who have pregnancies with complications. It's the same with women who have periods. There are people who have normal periods and painless periods, who are the luckiest women in the world, I think. And then there are people who have complications, who may have endometriosis and other conditions which cause them to bleed very profusely. So the point I'm trying to make here is you have to have an element of inclusion, that everyone is allowed to take time off according to the requirement. Everyone may not need the same amount of time, but in special cases, you should make some sort of an allowance over there. I think that is a humane thing to do in these situations.
So, Dr. Akshata, I think in these situations, the couple has to work also and face the or go through the treatment also. So, both the things have to go simultaneously. So, can you suggest some coping mechanisms for them? How they can take care of these emotional and psychological problems that they face? Are there any sort of strategies that you will recommend so that they can be at peace and at the same time they give justice to their work as well as to the treatment?
So the theme for this year's World Mental Health Day is mental health in the workplace, So that is why this topic is even more relevant for us. The ironic thing is that every article I have read so far or every interview by anybody, the focus is always on how can the employee reduce his or her stress. The focus is never on what can the company do. And this is actually a question that should be done at the policy level at the company, rather than telling people, please manage your time better and please exercise and do yoga and eat better and eat clean and all that. You need to have policies in place which are going to benefit your employees. And I know this is a very complicated question, so I'm not going into detail, but since that is not in our hands, again, the only thing we can focus on is asking people that try to have some sort of a balance in your life. For example, very common thing that all of us do when the day is over, we go back and spend a lot of time scrolling on our phone because it gives you some sort of entertainment. It gives you, you can disconnect from everything for some time. Rather than that, it would be a healthier option to do something like to exercise, to go for a walk, something a little bit healthier. Try to be more mindful about everything that you do. If you're eating something, opt for a healthier option. You cannot eat salads every day. It's not, I don't think that's easy for anybody, unless you are very, very, very determined, and that gets difficult. So I would say in every situation, pick the healthier option for you. For example, if you know that you can order a meal from Swiggy, which is healthy versus slightly on the calorific side, opt for the healthier option. The point is you're still eating outside, but you're eating something a little healthier. So opt for healthier options in everything instead of taking Using your free time to scroll on your phone, use it to exercise, use it to read, use it to spend time with your friends, socialize, get out there, spend time with your partner, travel when you get an opportunity. Do things that you enjoy, that would be the only way I can see here. Also, other things like having good social support goes a long way, so if you have good ties with family and friends, they are there to take care of you when you're having a tough time, so that also makes a big difference. And finding some sort of a connection with anything, it can be something spiritual, it can be something religious, it can be something absolutely different, but finding some sort of meaning or purpose in your life also helps.
That's absolutely right, Dr. Akshata. You told about what the couple should do. In the beginning, you also mentioned about the what company should do. So, to be a little more, to go into more details of that, what do you think the employers should do in such cases? Means what should be their plan of action to help these couples take care of their stress, at the same time give justice to the work that they are doing at the company, and continue the treatment also.
So, the recent incident which we heard about, a company where a very young employee passed away very suddenly, we are all aware of this incident. And this has brought a lot of questions up about corporate culture, about how things are done and what their working hours are. And from what I've heard from a lot of my own patients, it's quite brutal. I mean, 10 hours is not the maximum, it's the bare minimum that they are doing, and that is excluding your commute and everything. In a city like Bombay, for example, having a 1 hour, 2 hour commute is very, very common, So I'm just saying, imagine a 10-hour, 12-hour workday plus a 2 hour commute after that. I mean, what time are you left with for anything? So even if you go to the best therapist who tells you that you need to exercise, you need to eat better, you need to do this, टाइम कहाँ है तुम्हारे पास ये सब करने के लिए? टाइम ही नहीं है. So first thing would be to have better timings for everybody, like if your work ends at say 6 o'clock, let it end at 6 o'clock. It should not carry on from 6 p.m. to 6 a.m. I've had patients who've told me that they've answered emails at 3 in the morning, नींद टूट गई, check किया, boss ने email किया है, they responded also at 3 in the morning. Boss is awake at 3, so I have to respond at 3. That was the response. And in most places, it's a trickle down effect. So if the boss or the people at the top are very difficult, then the same thing carries on forward. So having more balance in terms of timings, being compensated appropriately for all the extra hours that you put in, which is again not a common thing over here, but that is something that should be there, because of course you will get some sort of incentive. It's not the best thing, but at least you will have some sort of incentive to work harder. Keeping a civil atmosphere. I'm not even going to say pleasant. I'm not even going to say cordial, because I know what goes on in a lot of these offices, but at least let it be civil. Don't use unparliamentary language, treat everyone with respect, treat everyone with courtesy and kindness. This might seem like a small thing, but going to a workplace where everyone talks to you kindly, respectfully, or at least in a civil way, it's a very simple but a very effective way to maintain a good workplace environment. I think having more options to work from home, or having, because I'm saying because of the commute, would be helpful for a lot of people, especially those who live far away, So these are things that companies can do, give more facilities to the employers. Also, in terms of medical benefits, I think whatever they can add, either in terms of covering therapy, which nobody does. I don't think anybody is doing that right now. Very few people are doing that. Covering therapy, having an in-house therapist, getting them to cover certain sessions, getting your insurance to cover your mental health, among other things, And of course, medical benefits for infertility or for any other medical conditions that are there. If they were covered by the company, even partially, I think that would be a good way to start.
So, yeah, I mean, you really pointed out the difficult work culture which the employees are facing currently. So, what do you think should be an employee's, uh, uh, what should they do if they feel that their infertility journey is affecting their workplace productivity, or even if it is affecting their performance? I believe what you described just now. I mean, this question seems all the more this because if it's going to be 12 hours work, and at the back of their mind they have their fertility journey on going on. So what do you think they should do then?
So I remember in one of the initial episodes when we were discussing this, and I remember telling you this incident where I asked one of my patients that, when they kept saying that they're not able to conceive. And the question I asked them is that, how often do you have intercourse? And the answer was hardly ever. I mean, how can you have a conception without that? So here also, if you're working 12, 14 hours, you barely have time to eat and sleep. How do you expect somebody to take the next step after that? It's very common for couples to fight because of this, that you don't have time for me, you're not interested in having sex with me. It's a very common complaint that both genders are going to have. And time nahi hai, 12-14 घंटा काम करके, where are you going to have the energy to do anything after that? So what I'm trying to say here is getting reasonable working hours would be a great first step. I mean, the simplest step over here. If possible, stay off your phone when you can. If you're not in a situation where you have to keep your phone with you all the times, please switch off. Try to take breaks together as a couple so that you have time for each other and for yourself. And as much as possible, try to get the kind of support that you can from friends, from family. Even, for example, having somebody to watch the kids while you take a break for a day or two, a small thing like that also, it goes a long way.
So you mentioned previously that companies should offer compensation, like maybe in the insurance or whatever for their fertility journey or even their mental health journey. So how important is it?
I feel that it is extremely important because one thing, it also shows acceptance from the company's side. When you show that you have a policy saying that your mental health will be covered by us, it is your way of saying that we understand there are problems and we are willing to help you out. You're not just saying ki हाँ ठीक है जाओ yoga करो हो जाएगा सब कुछ. You're showing that you genuinely care. The same goes with covering specific medical conditions like infertility. It is your way of showing that you understand it's a problem, you acknowledge that it's a problem, and you would want to take the next step of helping your employees out. And also, coming back to actually the previous question, one point I wanted to make was when we were talking about how stress and infertility are interlinked. Now, we've had this conversation before about raised prolactin levels in women, okay, which is a very significant deterrent for conception. And in a lot of these cases, it's chronic. Like I have had a lot of female patients who were absolutely fine till they joined a very stressful work environment, and then you see them developing PCOS and other problems. Okay, now with men, it can be that they'll end up with performance issues because there is a lot of stress, there's a lot of anxiety. There's a lot of worry कि कल क्या होने वाला है? What am I going to do 5 years from now? What am I going to do 10 years from now? Add to that the responsibility, the whole thing that because I'm the man, I have to take on the emotional as well as the financial as well as the physical, and every responsibility is to be taken by me. About what a lot of men go through also. Again, this is something we don't discuss a lot because everybody assumes they're having it easier. That's not always true. So obviously that would lead to performance issues as well, right? You cannot expect somebody to perform that well sexually if they are not in the right space of mind. And again, this is something people don't understand that, they just assume, okay, it's a man, so he has to have a very high sex drive. These are misconceptions people have that he has to be able to perform at all times. That's not true. Physically, biologically, you can have a problem. You may be tired, you may be exhausted. There may be other reasons why. So this again, I feel is it's a very underrated thing that from the masculine point of view over here.
Right. So you said so far that if the couple shares about their problem at the workplace, then they may face so many problems. So suppose they don't want to share and they want to keep it secret to themselves, then what type of challenges they may face or what should they do in those circumstances? Can you give some suggestions? Because there are some couples who don't want others to know at all, but they of course they face different sets of challenges. So can you tell about more about that?
Ideally, it would be great to have someone to confide in, if it is not at the workplace. Some people are not comfortable bringing up personal issues in the workplace. And I think in terms of etiquette, there may be some situations where it may not be appropriate as well, at the workplace, why during working hours, I'm saying. It's a different thing if you are making friends at work whom you spend time with outside as well. That's a whole different thing. But for those of who can and who are making friends, that's great. Bigger social support network you have, the better for you. For those of you who cannot confide to people at work, that's also fine. But find somebody in your personal life, maybe another set of friends you can talk to, or some family members. Have an outlet somewhere for you to talk. And if you do not have that outlet anywhere, then please talk to a therapist. You have to have a way to vent what you're feeling. You have to be able to express. You have to have a space where you can talk about these difficult things. Even with your partner, both of you will reach a point where it will be difficult to have this conversation because it's the same thing you've been talking about for a long time. And you both are in the same boat. So there's a limit to how much you can comfort each other. So after a point, yes, talk to a professional. If you are not getting that kind of social support, or even after having it, you feel that something is lacking, maybe someone with an unbiased opinion, someone who's a professional who can direct you better, yes, go for professional help. But always remember, in any of these situations, it is your prerogative how much you want to share. At the most, I would say that keeping your senior colleagues appraised of the situation would be helpful, because if you need to take medical leaves and things like that, it would be better for someone to be aware that this is the medical situation around it, which is why so many leaves are being taken.
And absolutely right. I think you told a very important thing that in this fertility, infertility journey of the couple, along with the fertility specialist, yes, there is a big role for a psychotherapist and even sometimes psychiatrist to play to increase the success of the fertility treatment. I think you will agree with me. What do you say?
I definitely agree. I feel it has to be a combined effort from all of us, because there are certain aspects that, should not be overlooked. We should not take them lightly. And I think the outcome is always better when we look at everything together rather than seeing it as fragments. Any part of medicine you go through, when you see the patient as a complete entity, yes, you definitely have a lot more success rather than seeing them as bits and pieces. And I think here we need to work in tandem to ensure that our patients get greater success in terms of the infertility issues as well as the mental health issues.
So sometimes, a simple act of listening by a doctor, any specialty, makes the patient feel so comfortable and at ease. So imagine if, if their situation is handled together as a group. So things would be much, much easier for the couple.
Right. Coming towards the end, now see the main topic here, what we have discussed is the challenges at workplace. So the most important people or part of this workplace are the co-workers. So what would you say to them? How should these co-workers interact with them? So we always tell, okay, couple should do this, patient should do this, or husband should do this. What is the importance of their role? Can you just suggest more about that?
I think a co-worker's response is out of the control of that couple. I mean, it's difficult, but I think we should be giving a message to even the co-workers.
So, Madam has hit the nail on the head when she said that, what other people say is out of our control. So, I think very, very important fact for all of us to understand that what other people say, what other people do, how other people behave is always going to be out of our control, whether it is our siblings, spouses, children, parents. अपने हाथ में कुछ नहीं है. Most of the time we can barely control the way we are behaving. Okay, so don't expect to control other people. Now here, like I said, how the onus is on the company to do better rather than telling the employees to तेरा work life balance sort कर. The onus is on the companies जो नहीं हो रहा है, which is why we are stuck in this loop. Again, I will say the onus is here on the co-worker. It's not on the couple. Though we've been trying to tell everyone that this is how you should respond, this is how you should respond. The fact remains is people should not be asking you these questions. So for all of you who are working with people who have just been married or who are married and don't have children, Don't go around asking बच्चे क्यों नहीं हैं, बच्चे कब करने वाले हो, एक बच्चा हो गया दूसरा बच्चा कब आ रहा है. Don't ask such questions. Be very mindful. If they want to come and share things with you, that's a different thing. If they open that discussion with you and say that, you know what, this is what the situation we are in, we are struggling, do you know anyone who can help us? Then yes, that's a whole different thing. But asking invasive questions as to why don't you have kids yet? You guys have been married X number of years. क्यों नहीं बच्चा क्यों नहीं किया है अभी तक? Don't go there. Don't give unsolicited advice. Do you know the older you get, the harder it is to conceive? Do you know how old you'll be when your child is in college? Nay, don't say all those things. They are already aware. Everyone is already aware. With the internet and with the level of awareness right now, everyone knows everything. You don't need to sit and give gyan. Okay. Third thing, try to be supportive. If someone is telling you something, be non judgmental, be supportive, try to understand. It's also completely fine that if you don't understand something, that's fine. You can always go and learn about it. I have met a lot of people who don't know anything about mental health, but they're willing to learn. You know, a very common scenario is a lot of young adults come by themselves because they say, घर पे बताया तो family will not understand. At some point, some of them bring their parents. What I've noticed is a few of them are very open minded. They go back once you talk to them and say, you know what, your kid has depression. When I say kid, it's a young adult usually. Because they've come by themselves. They will go back, they will read about it, they will understand everything, and they will start trying to help their kid in whatever way possible. So, if you don't have the answers, you don't have the information, that's fine. You can always make an effort to learn. वो भी नहीं हुआ तो ठीक है, just be supportive, just being present with somebody and saying I'm there with you, whatever you need I will help you. You want to sit here and cry in front of me, I'm there. You want to talk about it, I'm there. You want to go out, have a cup of tea with me, I'm there with you. That's more than enough. You don't have to be an expert, you don't have to give knowledge, you don't have to give gyan, just have to be supportive. Be kind, be empathetic, be a good human being. That's all we are asking of you.
So I think this was wonderful. I think the subject was little unusual in the sense, as yes, commonly encountered by patients, but very important to address because a lot of a part of our life or the working couple's life goes in office, and a lot of interaction occurs with their colleagues, sometimes in the office, outside office. So this becomes very important how they can handle this interaction in the workplace. And therefore, as you said, mental health at workplace is an important issue, and even World Health Organization has felt that it is important to address. And therefore, we feel that the way you have nicely explained how the couple can take care of themselves, how the co-workers can help them, how the company can take care of them. I think all these three factors come in play, are in place, and they do their own job or own work. Then I think the life of this couple will become definitely means it will be bearable, where they will be able to handle the problem better. And who knows, yes, it will definitely help them to develop that positive attitude, and it will help them to succeed in their treatment and definitely making them happier. What do you think, Dr. Mugdha?
Yes, yes, definitely. Thank you, I would say, for Dr. Akshata for addressing a very less commonly addressed issue. And I think we need to come out in the open and discuss it, whether it's the couple who's going through or the people who are around them, that how do they need to behave. That is only when a change is going to happen. Because ultimately, there's always a mind-body connection. And addressing this thing openly, which of course WHO is coming through, but we also as doctors should address it openly. Or other employees should also, the employers, the employees, both should address this, help in best ways which is possible for the couple, so that, somewhere this mental health issues will be brought out in the open, will be accepted it to be a part of a mental health. Like, okay, if someone says, I have infertility, so infertility is associated with depression. So a physical ailment is associated with a mental health ailment, should be accepted. So whether you're giving treatment for infertility, you also should, you're covering treatment for infertility, at the same time, we must also cover the treatment of mental health issues. And we are very grateful to you for you giving us this time. And to our viewers, like and share. Share this to only one person you all know. And trust me, it will change the life of that probably one person or many more who will be helped through this. We will always be available on our YouTube channel, Dr. Raut Center for Reproductive Immunology. This program will be available live on the YouTube channel again as a recorded version. So feel free to go through all our previous episodes. This is the 6th episode. And next Wednesday, we come with a final and the last episode of the series. Thank you once again.
Thank you so much. And